Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG platform, and now we have the full Sunday with us, and we're going to talk some amazing stuff regarding the image-based revision of pediatrics, as everyone was requesting one of the most awaited video where we're going to talk about some amazing images, pictures. I'll be asking you questions, and if you don't answer, then it's gonna be very cute. Yes, let's start. Yeah. Yeah, I think my voice is audible to me. I assume, yes, you can hear me and as well as you can see me. Hi, Mansi. Good evening. Good morning, Mansi. Let's start. So I'm Dr. Anand Bhatia, MD Pediatrics, and let's start this session. First of all, I recommend everyone to give as many tests as possible. In the fourth week of the April month, we have this amazing test series happening for anatomy, biochemistry, anesthesia, all the amazing test series we have with the time and the date every day beautifully 10 p.m. we have this test series. If you're free, just come and give the test, it will be nice. Also at the same time on the May 1st we have this all India mock test happening at 9 a.m. So again, if possible, give this test. It will be nice for you. Hi Priya, hi Vaidehi, hi Dr. Narendra Verma. In the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription of the Unacademy, you get all the amazing access to the live and recorded classes. Educators are good. The test quality is good. You can watch me on your iOS laptop, and an amazing question bank we have. This was the Plus subscription. In the Iconic subscription, you get the Unacademy platform and the Prep Ladder subscription. Clinical notes, video lectures, rapid revision, everything you get on the Iconic subscription. And also the new pack which we have done because exam is very near. So we have this very light pack, Unacademy Light for the PG students, with basically with the previous year question papers and the amazing grand test pertaining to NEET PG, INICT, FMG, and all the other amazing exams. Okay. Also at the same time for the MBBS first year, we have made this for pertaining to next exam. We have this batch basically started from April 20th. Just now the batch got started. The duration, the price and the pre-launch price automatically it is there. Anyone wants to take can take it. You can use any code because as an MBBS student, sometimes it's difficult to buy an expensive pack. If we use this code Dr. Anand, it will be little financial benefit for you. That's it. And we have already told regarding the NEET PG previous year question bank. PYQs are everything okay. Nishi Agarwal, Rashmi, Priya, Arpita, previous year question papers are really important. Also every day I'm launching this automatically daily practice papers DPP. I hope you guys are giving those tests because tests are like are like a point where we can get to know where are we standing. Okay. If you're new to Unacademy, download the Unacademy app. We have some amazing special class features like you never miss the classes because all the lectures are beautifully recorded. At the same time you get the lecture notes also, and everyone wants I want notes, I want notes. So these are notes only. Okay, that's it. The FMG batch, we are starting for 1 month from April 27 to May 27 with the MCQs marathon. Also, I told you the Plus subscription, Iconic subscription, and the Light subscription. So whatever you want, you can take it. Okay. Yes, let's start this beautiful class. Today is Sunday, and today whole day I am free. We have some 6 hours of back-to-back lectures. We have today live classes, 3 hours over here on YouTube and 3 hours over there on the special classes. So if you guys are free, then do join. Right now, the topic of choice will be exactly image-based question revision. I'm gonna show you an image and try your best to answer. Before starting any amazing segment, we always have a motivating quote, and today's motivating quote says, if you can stay positive, if you can stay positive in a negative situation, you win. If you can stay positive in a negative situation, you win. So you have to stay positive. I know exams are tough, I know it's very difficult, I know there's too much to remember. I know there is so much that I forgot to revise. I'm not able to revise. My friend has studied more than me, she knows more than me. I'm not able to retain. I'm getting yesterday also 3 students messaged me. They were like, hey, I'm planning to give a PG again after 6 months. I'm lacking confidence, people are bullying me and this and that, so I have to talk to them also. So that's what. So the thing is, like, if you can stay positive in a negative situation, you win. Try to stay positive, try to calm your mind, everything will make sense by the end of the journey. Okay, that's it. Let's start the beautiful class. Today's topic of choice is image based. Please You have this image in front of you. Could you please tell me any special point about this image? Every image I want at least 3 points, 2 to 3 points, that's it, nothing else I ask from you. Just tell me the important points pertaining to this image. Anyone? Dom, Swaraj, Benedict, Nishi, Rashmi, Priya, Arpita, Narendra, and thousand more students. So yes, so what is this picture shows? Anyone? That the if I show you one more hint, if I give you this one, so now I think everyone knows about it. Have you heard of champagne glass pelvis? Where do you see champagne glass pelvis? Of course, champagne glass pelvis you see in achondroplasia. You see in achondroplasia, very important. So I'll show you one picture of the achondroplasia, this one. Can I say that this is a case of achondroplasia? Now I have three more questions to ask you in this picture. Achondroplasia, could you please tell me, is this the example of short limb dwarfism, or is this the example of short trunk dwarfism? That is the first question I have for you. The second question is basically, yeah, so yeah, what happens to the upper segment lower segment ratio in the case of achondroplasia? Will it decrease or will it increase? What do you think? Priya is right. Priya has put an extra point. It is FGFR3. So let's revise. Okay, we are having this live class. Revise whatever knowledge you have. Transmit over the comment in the comment section. Tell us so that we all can share with each other. So yeah, exactly. Point number one, achondroplasia is nothing but FGFR3 gene mutation. Achondroplasia is an example of short limb dwarfism. In the short trunk dwarfism, what happens to upper segment, lower segment ratio in short trunk? When the trunk is short, then the upper segment, lower segment ratio decreases, and opposite of that happens in short limb dwarfism. Upper segment, lower segment ratio increases. That you should know very importantly. What is the inheritance? My next question is, what is the inheritance in achondroplasia? Is it autosomal dominant inheritance or is it autosomal recessive inheritance? Who will tell me? Okay, very good. Yes, Swaraj, Priya, Mansi, Arpita, very good. Whatever knowledge you have, whatever you have studied, no, put the answer in the comment section. It will be good. You will get a good revision. The answer is it is autosomal dominant inheritance. Autosomal dominant inheritance. That's important. What about this one? Acrodermatitis enteropathica. Acrodermatitis enteropathica. This inheritance, is this autosomal dominant or autosomal recessive? Who will tell me? Kavya, Hamotharan, Swaraj, Benedict. Exactly. Acrodermatitis enteropathica is autosomal recessive, whereas achondroplasia is autosomal dominant. Number one. Number two, this one more thing also. Do we have some hand finding? Do we have some hand finding in a case of achondroplasia, which is like some special name about it? Exactly, yes. See, Ara Nishashri answering so good. Very good, Panchal. Very good, Swaraj, Hemant. Yes, we have something known as trident hand. Trident hand is nothing but seen in achondroplasia. So trident hand, nothing but like a trident hand. It is seen in achondroplasia. Remember that. Okay, perfect. Next question. Yes. So if I show you this picture, very important. What can you comment on this picture? What will you write and come in this picture, bro? This some, I don't know, something like this. Okay, it is like this. It is like that. Yeah. So what do you call this sign if it goes like this? I think everyone knows about it. Have you heard of coiled spring sign? Yes. Where do you see coiled spring sign or where do you see claw sign? So the answer is intersusception. Exactly. Intersusception. Right. That's true. And one more thing. What is the triad of intersusception? Can anyone please tell me? So this was a recent NEET PG question. If you have given the last year only this question had come. So last 3 year question papers are very important. I'll repeat again. Very importantly, Akhil also. Akhil, very good. Answering very good. Yes, so I'll repeat again. Yes, you're right. Rashmi, Nishi, Vaidehi, Abhijit, whatever extra points you know about any disease, comment so that you can revise and it will be good for everyone. This is the case of nothing but claw sign or coiled spring sign. Point number one. The triad for the intersusception. This is the intersusception case. That the mnemonic is PPR. P for pain abdomen. Another P is palpable mass, pain abdomen, palpable mass, and red currant jelly stool. Red currant jelly stool. This is the beautiful triad of interception. Okay, will you remember this for me? Okay, great. So people are already beautifully answering. Very good. More common in 4 to 10 months of children. Yes, that's right. Okay, Nishi, Benedict, Mansi, very good. Perfect. Amazingly, you guys are answering. Let's make the use of every single microsecond in this class. Next important point, yeah, this one. This is a good one. I know this one. This child, a 4-year-old child, a 4-year-old child came with complaints of the swelling of the wrist, basically swelling of the wrist. A 4-year-old child came with complaint of swelling of wrist. So what will you tell me? What do you think, Mansi, Swaraj? Yes, exactly. Whatever extra points you know, just put it on the comment so that you can revise to every single depth of it. Okay. Yes, so this is saying maid lungs deformity which is seen in Turner syndrome. No, maid lung deformity thoda sa alag dikhta hai. Okay, widening, yes. So my question is that this patient, she's having this widening of wrist. Yes, so you're right. So again, Nishi Agarwal is right. See, my HOD used to say common things are common and rare things are rare. Okay, so the common thing of a baby come with swelling of wrist. See, swelling is something which the mother will tell, okay, like a layman. But the patient is having, you can say widening of wrist, widening of wrist. So widening of wrist with bowing of legs, where do you see? Yeah, of course, you see in a case of rickets, yes or no? And what do you call it? That's what. So, and what is the X-ray finding of rickets? I think everyone knows about it. The X-ray, very, this could be a very important question. This one, okay, this one, ye wala. Number one, we have cupping. This ये जो ऐसे है, this is nothing but cupping. Then we have fraying, this kind of this appearance. This is nothing but fraying. So we have cupping, fraying, and splaying. What is splaying? Widening of the wrist. Widening of the wrist is known as exactly. Yes, it's playing. So Priya sir, in hemophilia, upper joint swelling can be there. Yeah, definitely, of course. In hemophilia, upper joint swelling is a layman word, right? It could be platelet disorders, could be a bleeding disorder, could be a large joint like a hemarthrosis and hemophilia and all that. Could be a small joint like ITP or anything like that. So yeah, the differential diagnosis could be really a lot of differential diagnosis. Okay, remember that. Chalo, cupping, fraying, and splaying is the X-ray findings of rickets, and this is what you need to understand for the, yes, exactly. Panchal is already telling. Acha, I have this question. I was reading it recently. If I give vitamin D treatment, if I give vitamin D and calcium treatment to a case of rickets, there was an X-ray showing this cupping, fraying, and splaying. I did vitamin D. I gave. When I should, what do you call it? When I should go do the next X-ray? Of course, as someone told, I would like to see the healing signs of rickets, right? Today I got rickets. You gave me treatment. You'll call the patient again, no? You will call the patient again to look for the signs of improvement. So repeat X-ray कब कराना है? When do you want to get the repeat X-ray done? Dr. Giri, good morning, bro. How are you, bro? कैसे हो, bro? ठीक है तू? Exactly. Rashmi has the best answer. Rashmi has the best answer. If today we have diagnosed a patient of rickets, so you have to call the patient after 4 weeks. Why, sir? Why after 4 weeks? Because, dear, to look for the signs of healing, to look for the signs of healing in X-ray. So X-ray of the rickets is usually repeated after 4 weeks to look for the signs of healing. To look for the signs of healing. Remember that, okay? Perfect. Next question. Yeah, very easy question. Can anyone put an answer in the comment section? Yes, yes. Very good. Very good, Rashmi. Beautifully answered by Rashmi. Whatever you guys, you point, you put the answer in the comment section. Finish the whole book, okay? Whatever knowledge you have, transmit, share, transmit, share. See, I'm also sharing, right? Whatever knowledge I have, you also share. Hmm. Yes, Swaraj is right. Hmm. Okay, someone says NEC, huh, you can say that. So it's nothing but a case of football sign. In a case of pneumoperitoneum. In a case of NEC, yes, this looks like a newborn X-ray only. It's nothing but football sign seen in NEC. Okay, football sign. What is the name of just staging for NEC? Can I have, I am a NEET PG student. Can I have just 5 important points for necrotizing enterocolitis? What is NEC? Necrotizing enterocolitis. There is a problem with my intestine, okay? Necrotizing, my necrosis हो गया किसका? Enterocolitis. My intestine full inflammation and necrosis has happened. I am a NEET PG student. I really don't know much. So could you please tell me NEC? What is the name of the staging for NEC? As already people are mentioning modified Bell's staging. Yes, modified Bell's criteria or modified Bell's staging number one is seen in NEC. That is very good point. Next important point. Can anyone please tell me? NEC is the most common GIT, emergency in a newborn. In a newborn, a newborn baby may, in a newborn baby, there's only one GIT problem. Newborn baby will not have duodenal atresia, jejunal atresia, this that. Like anything can happen to anyone, but what I'm trying to say is the most commonly in our nursery and NICU, most common abdomen problem, GIT problem in a baby is usually necrotizing enterocolitis, and mostly this necrotizing enterocolitis, it is usually seen in preterms, or is it seen in term baby? Who will tell me? Exactly. Put your best vibes, okay? Put your best of the best, strongest vibes possible. Exactly. It is usually seen in preterms. Number one, I'll repeat again, this is nothing but football sign. Football sign is seen in pneumoperitoneum in a case of necrotizing enterocolitis, the last stage. The necrotizing enterocolitis is the most common GIT emergency of a newborn, and the name of the staging is modified Bell's staging. And what are the stages? Can anyone please tell me how many stages we have? Stage 1, stage 2, stage 3. Then we have 1A, 1B, we have 2A, 2B, and then we have 3A, 3B. In stage 1A, can you please tell me what are the findings you will see? Exactly. Yeah, Akhil is right only. It is mostly seen in preterms baby. That's I agree with you. Stage 1A basically will have occult blood in the stool. Occult blood in the stool. Whereas stage B will have gross blood in the stool. So occult blood and gross blood, that is one important point. Okay, exactly. What about stage 2A and 2B? Can anyone please tell me? Oh, stage 1A में क्या मिलता है? In the stage 1A, you have pneumatosis intestinalis, pneumatosis intestinalis, pneumatosis intestinalis, and stage 2B you will see portal vein में gas. Portal vein gas you will see. Can anyone please tell me portal vein is formed by dash and dash? Who will tell me? Very fast. Very good. So portal vein is formed by what? Portal vein is formed by dash and dash. कौन बताएगा? कौन इधर आगे आजा. क्या नाम है उसका? गिरी. बता. आंसर बता. कुछ नहीं कहूंगा, अगर नहीं गलत बताएगा तो मारूंगा, थोड़ा सा ज़्यादा नहीं मारूंगा, पर आंसर बताओ. पोर्टल वेन इज, हु इज गुड इन एनाटॉमी, कैन यू प्लीज टेल मी? पोर्टल वेन इज फॉर्म बाय डैश एंड डैश. Yes, exactly. The answer is Priya has told the right answer. Superior mesenteric vein and splenic vein. Superior mesenteric vein and splenic vein forms the portal vein. You know, right? This side we have the spleen, no? So this is the splenic vein, okay? And down we have the superior mesenteric vein. So superior mesenteric, this is the superior mesenteric vein. This is the splenic vein. Superior mesenteric vein and splenic vein forms the portal vein. Okay, that's it. So again, I'll say we have the three stages of NEC: stage 1, stage 2, stage 3. It has 1A, 1B, like yeah, suspected NEC, confirmed NEC, and advanced NEC. So 1A, 1B, 1A will have occult blood in the stool. Stage 1B will have gross blood in the stool. Stage 2A will have pneumatosis intestinalis, nothing but bowel wall edema. बावुल की वॉल में एडिमा होगा, ठीक है. एंड व्हाट एल्स? स्टेज 2B विल हैव पोर्टल वेन गैस. स्टेज 3A, कैन एनीवन प्लीज टेल मी वेरी क्विकली, स्टेज 3A में क्या मिलता है? गिरी कहाँ पे है? Akhil, Amra, Chakravarti, people who are answering has a very high chance they will be amazing successful people in future. Beautifully you're answering. Very good. Stage 3A or 3 में क्या होता है anyone? Stage 3 of course will have the features of peritonitis. Okay, and in the stage 3 भी तो बिल्कुल perforation रहता है, एकदम full perforation. Okay, stage 3A will be peritonitis and stage 3 will be pneumoperitoneum, perforation, yeah, all that bad stuff. Done? I hope you have understood. Perfect. Right. So has everyone understood this much? Please put a like button to this video, or at least please put a like button. Just put a comment that you have understood. You can say yes, or yes, or you can give a golden heart, or a black heart, or a blue heart. Okay, great. Let's finish it off in a very beautiful way. खत्म करते हैं कहानी. Yes, हमारे घर में वो बन रहे हैं, पता है, आलू पूड़ी बन रही है और मुझे इतनी खुशबू आ रही है आलू पूड़ी की, दिमाग घूम रहा है मेरा. एग्जैक्टली. ओके, सो गिरी, आंसर दे दे तू, दिल बाद में देती हूँ. ठीक है. दिस इज अ वेरी ओल्ड पिक्चर, आई थिंक एवरीवन नोज अबाउट इट. ऑस्कर को भी पता है इसका आंसर. तो हु इज ऑस्कर? ऑस्कर इज माई डॉगी ऑल्सो नोज दिस आंसर. डू यू नो द आंसर? दैट्स द क्वेश्चन. एग्जैक्टली. दिस इज नथिंग बट हेयर ऑन एंड अपीयरेंस, नथिंग बट हेयर ऑन एंड अपीयरेंस, which is seen in thalassemia, or even some books say sickle cell anemia also. Now I have a question. I have a million questions for you. Number one, uh, Rashmi कह रही मैं मैंने इडली खाई. That's so sweet. Yeah, we are from Bangalore, South India. Like when I was in Bangalore, I used to eat idli. Can you please tell me why here on end? Why do you see? We have my word. ID name is my word. Okay, Priya, Swaraj, K Singh, and Rashmi. Why do you see? The question is why? Why do you see hair on end appearance in a case of this thalassemia? Can you please tell me why? One single line answer. ये ऐसे ऐसे ये ऐसे 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 ये क्या है ये इतना क्यों है यहाँ पे do we have a specific beautiful answer to this question very important the answer to this question will be extramedullary hematopoiesis extramedullary hematopoiesis when the RBCs like the are not forming properly then you know my sternum my bones my head all the places compensatory extramedullary hematopoiesis start to take place that is the first point yes we have Vasanta Kumar who is very right Vasantha yeah that's right and what is the this one peripheral blood smear finding in a case of this one what do you call thalassemia. Exactly. Very beautiful told by Swaraj Priya. Yes, very good. So what is the peripheral blood smear? Peripheral blood smear finding में क्या मिलेगा? Will you get macrocytic hypochromic anemia? Will you get a normocytic or a dimorphic anemia? So the answer is nothing but we'll get a very importantly you'll get a microcytic hypochromic anemia. Microcytic hypochromic anemia is the normal picture you get in a case of hair on end appearance or nothing but thalassemia. Perfect. Okay. Now interpret this X-ray, this picture. Like they now nowadays they're asking a lot of clinical questions. No, so interpret this photo. What is the first thing exactly? हाँ जी अभी पूछूंगा मेंटल इंडेक्स के बारे में. That's very good. So number one, yes, I can appreciate. Can I say this baby's hemoglobin is 8.4? So number one, can I say anyone having hemoglobin less than 11.5 in general, roughly WHO cutoff is anemia. So once you see the hemoglobin low, exactly. Yes, yes, so nice. Akhil is answering hair on end appearance mnemonic is things thalassemia, hereditary spherocytosis, iron deficiency anemia, and basically then you said neuroblastoma and G for G6PD for sickle cell anemia. So very good, very good. I wish I could, what do you call star your this one. So guys, Akhil has answered very beautifully in the comment section. You can take a screenshot and later update in your notes. So hair on end appearance, which is seen in thalassemia or sickle cell anemia he has told the mnemonic is things. T for thalassemia, H for hereditary spherocytosis, I for iron deficiency anemia, and for neuroblastoma, and yeah, that's it. So very good, perfect. Okay, so the best answer to this question will be anemia. The patient has anemia, and the patient has microcytic hypochromic anemia. So microcytic hypochromic anemia, like this is a very easy question. Of course, everyone knows about it, right? What is the differential diagnosis of microcytic hypochromic anemia? That also we have done. The mnemonic is nothing but Sheetal, Sital. Yes or no? हाँ जी, sideroblastic anemia, iron deficiency anemia, thalassemia, and very importantly, anemia of chronic disease and also lead poisoning. These are the differential diagnosis. We know that, right? The differential diagnosis for microcytic hypochromic anemia is Sheetal, sideroblastic anemia, iron deficiency anemia, thalassemia, anemia of chronic disease, and lead poisoning. But that is not enough. That is not enough. Yeah, exactly. Priya is right. To learn mnemonics is also a biggest thing. I totally agree with you. Akhil, Sita is not the mnemonic. शीतल अब शीतल पे आ जाओ तुम सीता को छोड़ दो शीतल को पकड़ लो ठीक है शीतल even lead poisoning also can cause microcytic hypochromic anemia so update in your notes okay but I have a question here this is very simple but I need to ask something else my question to you is that how do you differentiate iron deficiency anemia thalassemia, and anemia of chronic disease. Can anyone tell me with any markers, can we differentiate these three things? What do you think, anyone? If I talk about serum ferritin, if I talk about serum ferritin, what happens in a case of iron deficiency anemia? Do we have increase serum ferritin or decrease? So most importantly, there will be decrease serum ferritin in a case of iron deficiency anemia. That is a very important part. And what about total iron binding capacity? What happens to the TIBC in a case of iron deficiency anemia? So everyone knows once serum ferritin decreases, so naturally I'll give you a call to the TIBC people total iron binding capacity to increase the production of the TIBC. In general, everyone knows that serum ferritin decreases and TIBC increases in a case of iron deficiency anemia. Now, I have a question. Dr. Giri, could you please tell us about the anemia of chronic disease, bro? How do you differentiate anemia of chronic disease from iron deficiency anemia, bro? What do you think? हाँ जी, अब कौन बताएगा? अखिल बताओ please. Could you please tell me exactly? So, okay, anemia of chronic disease, ferritin increase. Exactly. So, who told this answer? Priya. Priya is answering very good. So Priya has a very good answer. Inflammatory marker. Inflammatory marker of a chronic illness. Which is the inflammatory marker of the for the chronic illness? The answer is serum ferritin. I have osteomyelitis. I have chronic TB. Okay, I have TB spine. If I have a chronic illness, the inflammatory marker of the chronic illness is serum ferritin, and that serum ferritin increases, and naturally compensatory mechanism TIBC decreases. This was another important point for the anemia of chronic disease. Now, can anyone tell me, very important, how do you differentiate iron deficiency anemia from thalassemia? Who will tell me? We have Patel, Swaraj, Priya, Pragya. Yes, how do you differentiate iron deficiency anemia from the thalassemia? Hmm. Yes, very clear cut, beautiful answer, because serum ferritin and TIBC can be normal in these cases. Exactly. The answer is Menzer index. Can you please quickly tell me what is the formula for Menzer index and what is the cutoff of Menzer index? Very fast. Yes, beautiful. So for this, I would like to thank Dr. Pancake, one of our students. She told me this point. So Menzer, M for Menzer, M for MCV. In Menzel में what is the last letter? That is R, that is MCV upon RBC. Remember, in the Menzer, M is the first letter, so MCV. In the Menzer, R is the last letter, so RBC. MCV upon RBC is nothing but the Menzer index. And how much low and less and more is there in thalassemia? Yes, if it is, if the what you call in thalassemia, the Menzer index will be less than 13. If my Menzer index is less than 13, I have thalassemia. If the Menzer index is more than 13, I have iron deficiency anemia. How will I remember that answer? Exactly. So Priya again is mentioning less than 13. Thalassemia has the word less. Thalassemia. Less. So less. Thalassemia also word is there less. So remember less. Menzer index less than 13. If I'm suffering from thalassemia. If the Menzer index is more than more than 13, then I'm suffering from iron deficiency anemia. Perfect. Beautiful answer. Let's go to the next question. This is the next question. If this comes in the exam, what will you write and come? This is a cerebral hemisphere finding. Could anyone please mention it about this? Hanji, put your good vibes, okay? Strongest vibes I want. 30 minutes are over, 20 minutes are left, then this class is done. Okay, exactly. So इसको बोलते क्या है चक्रवर्ती? What is this sign? What is this sign? Anyone? Mansi? Well, yeah, what is this sign? This is nothing but, very importantly, puff of smoke appearance. Puff of smoke appearance. Where do you see? In Moya. Exactly. Moya disease. Exactly. Moya. So that's true. Yeah, Moya disease. Puff of smoke appearance is very important finding in a cerebral. This is a brain, okay? It's a cerebral hemisphere, like a puff of smoke seen in Moya disease. Very good. Yeah. Now this was a very simple question. Can anyone please tell me what do you call this? And why is this? What do you call this? And let's discuss about it for three important points. हाँ जी, कौन बताएगा? पांचल, रवि, अभिजीत. Very good. This is Puffo. Yeah, you're right, bro. Chakravarti, of course, everyone is beautifully answering nothing but Bitot spots, right? Bitot spots. Okay, I have a question. Number one, ये होते क्यों हैं? Let's put a very strong, good vibes in the class. See, Giri is answering very nicely. कि vitamin A deficiency basically can cause Bitot spots. I totally agree with you. Yes. Number one, this is vitamin A deficiency problem. Number two, this is known as Bitot spots. Number three, why? होते क्यों हैं? Priya, could you please, Akhil, why? Okay, I know you know the next question, that in which stage of the vitamin A classification you see Bitot spots. My question is why? Why this white patch? You don't have to cram, no? Understand the concept. Why? ये क्या deposition है? Is there a deposition here? This white thing, white is there. Is there some deposition of something? Can we have something, some point about it? Yeah, it is nothing but keratin deposition. No, Bitot spots are the buildup of the keratin. These Bitot spots, they are the buildup of keratin located superficially in the conjunctiva of the human's eye. So in general, I want the take-home message is nothing but Bitrot spots are the deposition of keratin. It is seen in vitamin A deficiency, and of course, everyone jumping with an answer. Bitrot spots comes under which classification of vitamin A? The X. Anyone? What? So already you have told also. I assume exactly. In the X1b classification, of course, you get Bitot spots. Now, can we please revise the vitamin A classification, Dr. Giri? X1A क्या होता है? बड़ा ऐसे चौधरी बन के बाग बाग के आंसर कर रहा है, तू आ गया तू. हाँ जी. What happens in X1A? What is the point I should remember in a case of X1A? पहले first there will be conjunctival cirrhosis or corneal cirrhosis. Which one comes first, conjunctiva or the cornea? Exactly, conjunctiva. Number one, there'll be conjunctival cirrhosis. Number two, there'll be Bitot spots, and then you can say, corneal cirrhosis will be there, and then we have the corneal ulceration. Please remember, first comes the conjunctiva, then comes the cornea. Conjunctival cirrhosis, Bitot spots. Corneal cirrhosis, corneal ulceration, less than one third and more than one third of the cornea. That is important. And also we have NFS. Anyone can please tell me what is it? N? N for night blindness, S for scarring, and F for fundal changes. Do you remember this? Yes or no? Have we ever done? This is a 5 marks MBBS question, for very important question for the MBBS students. So remember this point. Yes, I agree with you. Perfect. So we have night blindness, we have scarring, we have fundal changes. So this was the important classification. Remember, Bitot spots comes under X1b classification. First involves the conjunctiva, then involves the cornea, night blindness, scarring, and fundal changes. Perfect. या वेरी इजी क्वेश्चन, वेरी इजी क्वेश्चन. नाउ आई हैव सम टंग ट्विस्टिंग क्वेश्चन. अगर अब देखते हैं आंसर कौन कितने लोग आंसर करते हैं. या एग्जैक्टली. सो हिस्ट्री ऑफ ब्लू स्क्लेरा विद हिस्ट्री ऑफ रिकरेंट फ्रैक्चर. कैन यू प्लीज टेल मी हिस्ट्री ऑफ ब्लू स्क्लेरा with history of recurrent fractures? What is the best answer? Bitot spots, alkaptonuria, Ehlers-Danlos syndrome, or osteogenesis imperfecta? Yes, exactly. Akhil is right. OI. OI is the patient basically. I have seen real patient from AIMS and from many hospitals. Mother history of blue sclera, and mother gives a history of recurrent fractures. So recurrent fractures, as in even the mother says, once the baby gets up in the morning, she keeps the baby from one place to another. The baby gets a fracture. Little bit, someone presses on this one on the bone, the baby gets a fracture. Exactly. So I have a question. What is the triad? Now, अब मुझे triad बताओ. हाँ जी. What is the triad of osteogenesis imperfecta? हाँ जी, शुभम, आंचल, अनिल, Zara, Nishi, this one what CS, Pragya. What is the triad of osteogenesis imperfecta? Yes, exactly. So एक तो just now we are reading no history of blue sclera with history of recurrent fracture. So one line is blue sclera, one line is recurrent fracture, of course, that is nothing but fragile bones, and SNHL, sensory neural hearing loss. Okay, will you remember this for me? Yes or no? Already people are answering very good. So I already told no history of blue sclera with history of recurrent fracture. So blue sclera, recurrent fracture, nothing but fragile bones, and sensory neural hearing loss. I'll give you one chocolate. I'll give you one eclairs. Who like eclairs? Anyone? Do you like munch eclairs? Kit Kat. I like Kit Kat. Kit Kat is good. थोड़ा उसको ऐसे करके मजा आता है ऐसे करने में. Exactly. So can you please tell me that sensory neural hearing loss, it is a triad of some other problem also? Can we have any other diseases or any problem where in the triad there is sensory neural hearing loss? Who will tell me? In the so SNHL, Navneet book says SNHL is more common. Okay, Swaraj like Kit Kat and Dairy Milk. Okay, that's nice. Priya is right. Beautiful. Congenital rubella syndrome. Exactly. Can we link and study? Remember, okay, we have to link and study. Whatever knowledge we have, we have to discuss, and so that we become the best people of this planet. So congenital rubella syndrome, the mnemonic is cafe coffee day. I hope you know, right? Even Alport syndrome also be आगे आएगा. Even Alport syndrome also can have what you call the sensory neural hearing loss. Even Pendred syndrome also. Pendred syndrome was there in NEET PG. Pendred syndrome also the patient can have SNHL. Alport syndrome also patient can have an SNHL. Congenital rubella syndrome also patient can have SNHL, sensory neural hearing loss. The triad of congenital rubella syndrome is the congenital heart disease, which is the most common congenital heart and congenital rubella, patent ductus arteriosus, and then we have the cataract, and then we have the deafness, and which deafness? Again, sensory neural hearing loss. ठीक है, done. Done. Very good. Very good. Perfect. Marfan also, yes, the patient can have. I agree. And in this cafe coffee day, this one congenital rubella syndrome, which is the most common manifestation, which is the most common symptom the patient comes to can come. The answer is deafness. Deafness is the most common manifestation. The most common congenital heart is PDA. That you should know. Done. Okay, now I have some amazing question. नूनैन syndrome ऐसे तो सारे syndrome ही बोल दो तो वो याद रखना बस एलपोर्ट पेंड्रेट rubella and OI they will have SNHL sensory neural hearing loss. Okay, I have a question here. Oh, Akhil is full hi-fi. Usher syndrome, Javelin Lange Nielsen syndrome. Very cute names suits you only. Okay, I have a question. The question is history of blue sclera with history of recurrent fracture, and if I say it's a case of osteogenesis imperfecta, which is of course also known as brittle bone disease. See, what is the name of the classification? Akhil, could you please mention us now the name of the classification for this one osteogenesis imperfecta? Do we have some specific name of the classification? Exactly. प्रिया कह रही है मैं ये पहली बार सुनी मैं दूसरी बार ठीक है सो व्हाट इज द नेम ऑफ द क्लासिफिकेशन हाँ जी अखिल एनीवन हाई फाई पीपल फ्रॉम हाई फाई सोसाइटीज हाँ जी स्वराज अर्पिता रश्मि डॉक्टर डॉम वैदेही ऑस्ट्रियन जैसे imperfecta has some proper classification. The name of the classification is silence classification. Silence classification, exactly. So that's very cute. So yeah, Rashmi is right. So can we please remember, hello, can we please remember that silence, the baby's got a fracture, okay? So silence. So osteogenesis imperfecta, the name of the classification is silence classification. Where do you see gross classification? Anyone? Where do you see gross classification? हाँ जी कौन बताएगा? Very good. 15 more minutes and then this class is over. Exactly. So where do you see gross classification? हाँ जी Swaraj, Rashmi, the answer is TEF. I have taken a proper 1 hour class on tracheoesophageal fistula, right? So yes, TEF is very important. The name of the classification for TEF, this you are not answering, okay? अच्छा मेरे लिखने के बाद सबको आंसर आता है मुझे भी आता है ठीक है Okay, so the name of the classification for osteogenesis imperfecta is silence classification. The name of the classification for tracheoesophageal fistula is gross classification. What about the could we please have the name of the classification for hepatic encephalopathy? Anyone? For hepatic encephalopathy, do we have some classification? Yes or no? अगर इसका गलत बताया ना बेटा घर पे आके मारूंगा मैं हाँ जी क्या एग्जैक्ट थैंक गॉड प्रिया इज आंसरिंग वेरी गुड सो प्रिया वन स्मॉल हार्ट टू यू वेरी गुड प्रिया इज आंसरिंग वेरी गुड समटाइम्स आरपी आंसर्स वेल बट टुडे प्रिया इज आंसरिंग अखिल says Leveni staging Akhil says Leveni staging can we please help him and share the knowledge that Leveni staging comes under what अच्छा कुछ ही बोली जा रहा है ठीक है ओके क्यूट सो अच्छा ओवर हाँ this one so can anyone please tell me the Akhil again said Sarnet and Sarnet where do you use this Sarnet and Lebanese stage classification the answer is HIE yes or no the hypoxic ischemic encephalopathy we have the classification we have the Sarnet and Sarnet classification we have the Lebanese classification and one more can we have one more classification name of same HIE the answer is Thompson score Thompson score. Thompson score is done. So can we please revise? Very important. कोई बात नहीं अखिल dear, no problem. We always pull leg of each other. Okay, so don't feel bad or don't mind. We all are like one family, and we all are just discussing and sharing beautiful knowledge. So remember, silence classification is there in osteogenesis imperfecta because the baby got a recurrent fracture, no? So maintain silence. Silence classification in OI. Gross classification in tracheoesophageal fistula. In hepatic encephalopathy, we have West have and staging classification. For HIE, you have Sarnet and Sarnet, Leveni and Thompson scoring. And what about this celiac disease? A celiac disease, Hanji. Oh, Chakravarti is, messaging here and there. ठीक है. Perfect. Yes. So yeah, of course, for celiac only, already jumping with an answer, Marsh-Oberhuber classification. Marsh-Oberhuber classification. Okay. Marsh-Oberhuber classification is the name of the classification for celiac disease. What about Down syndrome? Do we have any criteria to diagnose Down syndrome? Down syndrome के लिए कौन सा criteria use करते हैं? What is the name of the criteria we use in Down syndrome? Can you please tell me? प्रज्ञा एल्पोर्ट सिंड्रोम आएगा तब बात करेंगे एंटीरियर लेंटिकोनस प्रज्ञा इफ यू वांट टू नो राइट नाउ एंटीरियर लेंटिकोनस हेमाटूरिया एंड सेंसोरी न्यूरल हियरिंग लॉस इज द ट्रायड डाउन सिंड्रोम द ट्रायड हाँ जी कौन बताएगा रवि अखिल कहाँ है अखिल please tell the answer? Sameer has the beautiful answer. So Sameer is answering very good that the name of the criteria for Down syndrome is Hall's criteria. The name of the criteria for Down syndrome is Hall's criteria. That's Ishno. Perfect. So can we please revise that silence classification was there in OI, gross classification in TEF, hepatic encephalopathy we have West Haven classification, for celiac disease we have Marsh Oberhuber classification. This West Haven classification for hepatic encephalopathy, can you please tell me how many stages are there in hepatic encephalopathy? कितने स्टेज होते हैं हेपेटिक एनकेफ की? 25. Okay, I have an option. I'll give you option: 6 stage, 8 stage, 10 stages, and 12 stages. How many stages are there of hepatic encephalopathy? Can you please tell? Three, three. Oh, three in your dreams. Huh? You made the book. You made the book. Three classific, three stages, madam. There are four stages. There are four stages. उसको BMW की भी दे दो, सफाई कर देगा अंदर से. हाँ दे दो, बोलो अंदर से कर देगा, वो कल आएगा नहीं, मंडे छुट्टी होती है उसकी. हम्म, उसे कह देना अंदर से भी कर देगा. अच्छा हाँ. सो रिमेंबर वन थिंग, 6, 8, 10, 12, व्हाट इज द राइट ऑप्शन? नो ऑप्शन इज राइट, ऑल फोर ऑप्शंस आर रॉन्ग. All four options are wrong. There is no right option. The best option is we have four. There are four stages of hepatic encephalopathy. I asked in the previous class also. And could you please tell me which stage will have asterexis? Hanji Rashmi. Yes, very good Rashmi. Which stage will have asterexis? Have you heard what is asterexis? Am I making sense to you, or am I speaking some Spanish or German which is totally going above the head? Asterexis. Yeah, what is asterexis? Nothing but flapping tremors. Do you remember that? Yes or no? Have we done this before, or we are doing for the first time? We have done hepatic NCAF class very beautifully. Uh, Arpita has the better answer. There are four stages of hepatic NCAF: stage 1, 2, 3, 4. Stage 2 and 3. Only and only in stage 2 and 3 there are features of flapping tremors. Stage 1 and stage 4 does not have the feature of flapping tremors. It is only the stage 2 and stage 3. You take the patient hand like this, do like that, and he will do like this, like this. This is known as flapping tremors, or known as asterexis. It is seen in stage 2 and stage 3 of the hepatic NCAF. Asterexis is absent in stage 1 and stage 4. Next question. This is also patient of osteogenesis imperfecta. Okay, this is a real patient of the osteogenesis imperfecta. Like it has multiple bone fractures everywhere. You know, the bone is getting fractured. So it's a case of OI, osteogenesis imperfecta. Okay. If I show you this picture, it's a very nice picture. Okay, इनमें से कितना कौन कर सकता है? Let's see. Okay, so बस होता है नवनीत, ये होता है, ये अंदर डिफेक्ट है congenital. हाँ जी, who can do this? Every morning, do you do this, Navneet? Do you do this every day? I don't think so. How many of you can touch your palm to the soles? Anyone? How many of you can touch your palm to the soles? Anji, what do you think? Navneet, Rashmi, okay. Arpita, can you do this one? So yeah, this Namaste sign, exactly where typically you seen this Namaste sign. So yes, this is a very beautiful. I also can do. Okay, and I also can do. So it's a very beautiful case, very important joint hypermobility, Namaste sign, and all those things very typical of Ehlers-Danlos syndrome. Ehlers-Danlos syndrome would be a better answer. Yes, exactly. So Ehlers-Danlos syndrome is a better answer. Okay. And this again, we have this beautiful case. Can you please tell me? I think everyone knows about it. So exactly. So this one, the baby is not able to get up from the sitting position. What sign is this? A very beautiful video. Can you please tell me which sign is this? The baby is not able to get up from the sitting position. Who told? Kyra's zone. Kyra's zone is telling the right answer is nothing but a Gover sign. There's nothing but a Gover sign. So where do you see Gover sign? Can anyone please tell me? This baby who is not able to get up. Okay, he's not able to get up. So where do you see Gover sign? Okay, and okay, so we have Mansi. Mansi says Gover sign is seen in DMDs. In what is DMD? Duchenne muscular dystrophy, right? So is she right or is she wrong? Can anyone please tell me? Mansi says that Gover sign is seen in DMDs. Exactly. So the best Kyra has a better answer. You know, exactly. Yes, exactly. What do you call it? Kyra has the best answer. You know, don't say just DMD, say muscular dystrophy, muscular dystrophies. There are various muscular dystrophy like Duchenne muscular dystrophy and Becker's muscular dystrophy. Do you agree with me? Yes or no? So That's what I'm saying. That Gover sign, it is not seen only in Duchenne muscular dystrophy. It can be seen in both Duchenne as well as Becker's muscular dystrophy. So ये एक तो ये याद रखना, ठीक है? जूली करी क्लास खत्म होगी, हाँ जी क्लास खत्म होगी, हम अंडे बांट रहे हैं, तुम खाओगे, अंडे खाती हो तुम, बॉइल्ड एग्स, यू वांट बॉइल्ड एग्स, कोल्ड कॉफी, जूस पियोगी, दिन का टाइम है, तुम्हारी सुंदर त्वचा के लिए जूस, क्लास चल रही है अभी, पढ़े हैं अभी 20 मिनट, मुंह उठा के तुम आ गई हो, हैं सो रही थी तुम, सो रही थी, ये सोता है कोई सुबह 9 बजे, कौन से सोता है तुम, हैं टाइम पे उठा करो. Okay, so the question, I have few questions basically. Gover sign to everyone told. That's a very beautiful point you have told. Exactly. Beautiful. That's nice. So I have one more thing I would like to ask you here. This baby will show you some other finding. Can we have any other thing we can see in this DMDs, in the Duchenne muscular dystrophy? This one. Yes. Now, ऐसे जो किया है ऐसे exactly. So what is this? Please, I'm preparing for my PG exam. Can you please tell me some points? This was Gover sign seen in muscular dystrophies like Duchenne and Becker's. ये बच्चे ने ऐसे किया, ऐसे ऐसे किया. अभी ऐसे करने से क्या होगा? ऐसे मैं भी कर लूँ, ये लो, मेरे तो 15.5 इंच के हैं, तो ऐसे करने से क्या होगा? Can anyone please tell me? हाँ जी. सो व्हाट डू यू थिंक दिस? वेरी इंपॉर्टेंट. कैन एनीवन प्लीज टेल मी? वो कहाँ गया? अखिल कहाँ है? हाँ जी, गिरी, 25 लोग, हजारों लोग आए हुए थे. हाँ जी, ये क्या एग्जैक्टली? दिस इज नोन एज वेले साइन. दिस, ये यहाँ पे जो ये बेंड है ना, ये दिस पार्ट, this is known as Valley sign. Very very important, could be an exam question. Where do you see Valley sign? The answer is very importantly, valley means घाटी, घाटी बनी हुई है, एक there's a bend. Why there's a bend? Because this side there is hypertrophy of the deltoid, and this side there is hypertrophy of the infraspinatus muscle. I'll repeat again, deltoid and infraspinatus, that much you should know. The hypertrophy of the deltoid and hypertrophy of the infraspinatus muscle, so that leads उनके बीच में, in between that, there becomes a valley, घाटी, known as valley sign. So where do you see valley sign? The answer is nothing but muscular dystrophies. Okay, valley sign, remember that, valley sign. And one more thing which no one has told very importantly, do you see pseudo hypertrophy of calf muscles? Yes or no? This one. So can you see this picture? This one, can we see hypertrophy? Can we see hypertrophy of the calf muscles? Can anyone please tell me, why do you say pseudo hypertrophy? This baby has good calf muscles, no? Why do you say pseudo hypertrophy? Anyone? Pseudo hypertrophy? Because exactly, we say pseudo hypertrophy because all the muscle has been replaced by fat. All the muscle has been replaced by fat. That is the reason you say pseudo hypertrophy. Real में there is no muscle, like the way Julie has full fat everywhere. So fat you have, okay, this baby no muscle, only fat. Okay, that's one. Again, very important picture. Can we appreciate this pseudo hypertrophy of the calf muscles? Photographic memory. Okay, this patient also had come. Okay, yeah, this one. Can we see that? This one. So this is nothing but pseudo hypertrophy of the calf. It's too big. Can we see that? Yes or no? Photographic memory. Hello everyone. Exactly. Julie says मैं पतली हूँ in my dreams. Okay, that's cute. So, yeah. So photographic memory. Okay, photographic memory. Remember that. So again, this patient I'm telling to get up. So now see this also. See, can you see that? Hello, can we see this one? See this, how he's getting up. Can we see that? Photographic memory, it could be a very important clinical question. Okay, this is something which is like on the spot diagnosis. Okay, without fail. Can we see that? We have so many patients in my OPD. We had so many patients of pseudo hypertrophy, and बहुत सारे आते थे. Exactly. Okay, so Akhil has very beautiful telling that Valley sign is also known as Pradhan sign. Yeah, I remember someday I also read it, Pradhan sign. This in COVID time that patient used to come. Can we see that? Yes or no? See now how. Acha. I mean, little difficulty this baby is getting up. Okay, exactly. Vipul keh raha hai, he's climbing on his own. Yeah, bro, I know that, but it is just a starting of that one. That's why. Can we see this? Yes or no? Can we see the Valley sign? Yeah, exactly. So this one is the Vele, this one, and behind is Lord Buddha's. You see the Lord Buddha. This one's photo. I only put it that one. So yeah. So that's what. So very importantly, this is nothing but the Vele. Can we see that beautiful picture? Exactly. What is the treatment protocol? These baby usually expire by some ages, some time like 18, 20 years. They don't live long. Slowly they will be bedridden. Slowly they will go down. Only symptomatic management is what you need to know. Only symptomatic management. Okay, this also Gover's sign. आप खड़ा हो जाओ, ठीक है. So that's what. So this is also same. So okay, let's move to the next question. And this is a typical Gover sign. Typical Gover sign. Yeah. Now, please, can we have some amazing questions now? Exactly. Yes, yes, yes. Yeah. So Raj says, sir, you made the picture of Lord Buddha. I wish, my dear, I had some such beautiful talent of sketching the picture. It's 120 rupees का wallpaper Amazon में मिलता है. उसको आप खरीद सकते हो. It's only 125 rupees. Okay, but it's amazing. Exactly. Yeah. So please, can you please answer good vibes? 10 more minutes, then we're gonna end this class. What is the gene mutation you see in Duchenne muscular dystrophy? The answer is XP21 dystrophin gene. Everyone knows it's already an exam question. That's why it was a FMG question. कौन से जीन का प्रॉब्लम होता है? डिस्ट्रोफिन जीन का प्रॉब्लम होता है. Next, yeah, very simple question. Is this yeah. Okay, Rashmi says that talent is there in Swaraj, sir. So Swaraj, I want you to sketch a picture of mine. Okay, can you sketch a picture of mine? I love getting sketched. Exactly. Okay, so yeah, it's a proximal muscle dystrophy. Remember, if I'm not able to get up, if I'm not able to get up from the sitting position, I'm not able to get up. So I'm having proximal muscle weakness. I'm having proximal muscle weakness. If I say I'm not able to put on my slippers, if I'm not able to put on my slippers, I have distal muscle weakness. I have distal muscle weakness. If I'm not able to do buttoning and buttoning, buttoning नहीं हो रहा मुझसे. I'm not able to button my t-shirt. So if I'm not able to do buttoning and buttoning, that will be again distal muscle weakness. Distal muscle weakness. And if I'm not able to do combing, कंघी नहीं कर पा रहा. वैसे तो I don't do comb. I just have, I'm like naturally smart. So if I do combing and combing basically needs my upper limb, needs my proximal part also. So if I'm not able to do combing uncombing, I have proximal muscle weakness. If I'm not able to do buttoning unbuttoning, I have distal muscle. If I'm not able to get up from the sitting position, I have a proximal muscle weakness. And if I'm not able to put on my chappals, I have a distal muscle weakness. Yeah, Shah Rukh Khan. Shah Rukh is nothing. We are more than that. Done. And which is the most commonest cause of death? Who will tell me please? Which is the most commonest cause of death in the GMDs? बच्चे क्यों expire होते हैं? मेरे HOD ने पूछा था. My HOD had asked this question. Every single word coming today, the 6 hours of session is like मोती की तरह है. ये clear होना चाहिए. The most commonest cause of death in DMDs is respiratory failure. Slowly, this baby will go into respiratory failure and go to God. Okay, Rashmi, you are amazing. Okay, yeah, exactly. So that's true. And which is the most common cause of death in Turner syndrome? Can we please revise few cause of death? This is my favorite part. Just one question and stick to that and ask 10 more questions and finish the whole book. Exactly. The most commonest cause of death in Duchenne muscular dystrophy is respiratory failure. Which is the most commonest cause of death in a case of Turner syndrome? The most commonest cause of death in Turner is coarctation of aorta. Coarctation of aorta, number one. Number two, which is the most commonest cause of death in measles? And which is the most commonest cause of death in Marfan syndrome? Can we please revise 5 important cause of death? The most commonest cause of death in measles, क्या था? The most common complication of measles is otitis media, and the most commonest cause of death in measles is pneumonia. Which is the most commonest cause of death in Marfan syndrome? Who will tell me? Nishi is right again. Akhil is right again. The most commonest cause of death in Marfan is aortic dissection. Aortic dissection. So can we please revise? The most commonest cause of death in Duchenne muscular dystrophy is respiratory failure. In Turner syndrome is coarctation of aorta. In measles it is pneumonia. In Marfan syndrome it is aortic dissection. Okay. And coarctation of aorta, can you please tell me what is the X-ray finding of coarctation of aorta? X-ray में क्या मिलता है? मैंने नहीं देखा है X-ray. Could you please tell me? हाँ जी डॉक्टर गिरी. And if you say the wrong answer, I will come at your. चप्पल कहाँ है मेरी? चप्पल यहीं रखी है. एक तरफ चप्पल रखी है मैंने, एक तरफ मैंने गिलास रखा है. हैक क्यों मार रहे हैं मैंने अगर किसी ने गलत आंसर दिया? हाँ जी. सो व्हाट इज द एक्सरे फाइंडिंग? या एग्जैक्टली, फिगर ऑफ थ्री. यस, फिगर ऑफ थ्री अपीयरेंस ऑन एक्सरे. दैट्स राइट. सो फिगर ऑफ थ्री अपीयरेंस you see in coarctation of aorta. Yes, of course, this Mamta also. Mamta is very right. You can say that three, E sign or reverse 3 sign. Many things you can. Epsilon sign. Lot of signs are there. At least figure of 3 you see in coarctation of aorta. And where do you see figure of 8 appearance? Figure of 8 कहाँ मिलता है? हाँ जी, Akhil is very right. Rib notching, but it's a very late manifestation. Remember that. हाँ जी. Exactly. Figure of 8. Figure of 8. Figure of 8 you see in supracardiac TAPVC, right? Supracardiac TAPVC. Supracardiac TAPVC. What is TAPVC? Total anomalous pulmonary venous connection. Exactly. So the question is, which is more severe? Which is more severe? Is Duchenne muscular dystrophy is more severe or Becker's is more severe? I always forget that. Anyone? Which is more severe? Duchenne is more severe or Becker's is more severe? I think Becker's maybe. I don't know. Anyone? What do you think? So the answer is Duchenne actually is, it is early onset. It is more severe. Remember that. Okay? It is more severe. That also you should know. Okay. And which is the investigation you want to get it done? If you get a patient in reality of patient of what do you call this one, so you'll get a CPK levels done. Whenever I told you know there's a pseudo hypertrophy of the calf muscles, muscle is breaking down, the muscle has been replaced by the fat. How will you get to know that muscle is breaking down? You get the CPK MB levels done, creatinine phosphokinase, and normally yeah, that's what. So normally it is 30 to 200. In this baby it is 14,402. Okay, 14,402. The muscle is breaking to every single level. Okay, every single level, that you should know. Okay, that you should know. And one more thing also I want to show here is, it's written here, measurement of creatine kinase are used in the diagnosis of treatment of MI or any muscle disease, even a myocardial infarction. If a patient is having heart attack, do you get trop T levels done? Yes or no? Have you ever got a trop T level done? Have you seen the trop T kit? Basically, when someone says okay, I'm having chest pain or I'm having cardiac damage, MI, myocardial infarction, you get a trop T levels done. So that also is like a muscle breakdown. Okay, so that you should know. Perfect. Next question, everyone knows about it. So 5 more minutes, then this class is over. What is this? Can anyone please tell me? What do you call this? Exactly. So at the costochondral junction, there is this round, round, round. Okay. What is this round, round, round? At the costochondral, okay, Priya says scurvy. So Priya is, could see this costo, it could be two things. Okay, this also very beautiful picture. Can you please, yeah, this costochondral junction, we have this beaded appearance, right? Costochondral bead appearance. So this is nothing but either it could be rachitic rosary or could be scorbiotic rosary. Rachitic rosary is because of vitamin D deficiency, whereas scorbiotic rosary is because of vitamin C deficiency. Rachitic rosary is painless. It is painless, whereas scorbiotic rosary is painful. Rachitic rosary, the bead which are there, no, the beads basically they are rounded. Okay, and what happens in scorbiotic rosary? They are pointed. They are pointed. That's right. Okay, Pragya, Becker's hemihypertrophy. No, dear Pragya, I'm very happy, Pragya, you are trying to answer. That was not Becker, my dear. That was Beckwith-Weidman syndrome. I'm very happy you had tried to link something. So Beckwith-Weidman syndrome. Do you remember Beckwith-Weidman syndrome? Beckwith-Weidman syndrome is one of the important causes of large baby and a big baby. And वहाँ पे you should tell these points: hemihypertrophy of limbs, macroglossia with microcephaly, with hemihypertrophy of limbs. With these babies can have increased incidence of umbilical hernia slash omphalocele slash Wilms tumor. ठीक है, that you should know. ठीक है, एग्जैक्टली exactly. ठीक है, स्कर्वी का ना अभी 12 बजे क्लास एक और है, मैं स्कर्वी का एक्सरे इसमें रखूंगा, तब मैं पॉइंट बताऊंगा दैट ट्रमर फील्ड जोन, पेल्किंस पल्स, तब वो ज़्यादा अच्छे समझ में आएगा. ठीक है निशी, एग्जैक्टली, परफेक्ट. सो कैन वी गो टू द नेक्स्ट स्लाइड? रैकेटिक रोजरी ओवर, स्कॉर्बियोटिक रोजरी ओवर, एंड बैकविथ वाइडमैन सिंड्रोम शी वाज आस्किंग, सो आई जस्ट टोल्ड अबाउट इट. Perfect. Okay, next one. Yeah, everyone, we have done this. Everyone knows about this one. Can you please answer? Do you like her necklace? What is the dermatological problem? What is the dermatological problem? Basically, you get in this case, which vitamin deficiency is this one? Everyone knows about it. We have vitamin B1, vitamin B2, and vitamin B3. The answer is vitamin B3, niacin. Which is vitamin B1? B1 कौन सा vitamin होता है, मैं भूल गया. Hmm. B1 is thiamine, B2 is riboflavin, B3 is niacin. Niacin deficiency basically can lead to a problem known as pellagra. And why only this area? Anyone? Why only this area? There's a specific answer for this. Why do you see this necklace or a burnt appearance or a dermatological problem only in this area? What is the best answer for this one? Who will tell me? Hmm. We have Zara, Arpita, Vaidehi. Why only this area? Castle's necklace. We call it Castle's necklace. No. Why only this area? Why not anywhere else? So the best answer with this one is exactly exact. Yes, Priya is right. Sun exposed. In 2 days back only we had a class with Dr. Cheshta. So there also I was telling, right. She also told us sun exposed area. this area is very much exposed to the sun. And also Dr. Cheshta in dermatology, she told that while the farmers know they work, they put their lungi little up, so you can see those a problem, this burnt appearances on the legs also, she said. But this is the sun exposed area number one, that's why you see this problem. This is nothing but known as pellagra. Pellagra is nothing but because of vitamin B3 deficiency. Vitamin B3 is niacin. और किन लोगों में होता है, which patients you will see this problem, and already someone has told whose staple diet is maize, जो कॉर्न खाते हैं, so maize basically has deficiency of tryptophan or deficiency of niacin leading to this problem. And Swaraj already told with there are 3 Ds: diarrhea, dementia, dermatitis, depression and death. That's it. Diarrhea, dementia, dermatitis, depression and death. Okay, 5 Ds हो गए अब. ठीक है, next one. Which we have already done. What are the drugs given intratracheal? In the yesterday class we have already done. I will not repeat this point. The drugs given intratracheal are the drugs given intratracheal. The mnemonic is nasal. We have naloxone, adrenaline, surfactant, atropine and lignocaine. Now extra question I have here. Dr. Anil, what is the dose of naloxone? Now tell me. Yesterday we did that. वो कहाँ है अपनी क्या नाम है हीरोइन, जूली कहाँ है, डॉक्टर जूली? हाँ जी, आंसर देना, आंसर जल्दी पढ़ाऊँ, स्लाइड चेंज कर दूँ, इसका आंसर दो पहले तो चेंज करूँगा. हाँ जी, व्हाट इज द डोज ऑफ नेलॉक्सोन? कैन एनीवन प्लीज टेल मी व्हाट इज द डोज ऑफ नेलॉक्सोन? मेरे को याद नहीं आ रहा, आई फॉरगॉट. कैन यू प्लीज टेल मी? निशी, वेरी गुड, कल ही हमने पढ़ा है, ये कल ही पढ़ा है. 0.1 mg/kg इज द डोज ऑफ नेलॉक्सोन. हाउ विल आई रिमेंबर? बिकॉज एड्रेनलिन का डोज क्या होता है, इज 0.1 ml/kg. ओके, the dose of adrenaline is 0.1 to 0.3 ml per kg. This one is mg per kg. ऐसे करके ml per kg, mg per kg, ऐसे करके आपको याद रखना है. ठीक है, समझ में आ गया? परफेक्ट, वेरी गुड. व्हाट्स द नॉर्मल ब्लड प्रेशर ऑफ अ 4-year-old? एक 4 साल के बच्चे का बीपी कितना होता है, जल्दी बताओ, जल्दी बताओ, जल्दी बताओ. That finishes this class. This is the last question. Then the class will be at 12 o'clock. 12 बजे अगला session है हमारा. ठीक है, with the next some 100 images of the rapid revisions of pediatrics. हाँ जी, I forgot. That's very cute. I also forgot. What is the blood pressure of a 4-year-old? Anyone? What is the blood pressure of a 4-year-old? Can you please tell me? 110/60. Do we have a formula or something for systole and diastole? Yes. So this is the formula. This is the formula. It's a 4-year-old child. For the expected systole, the formula is 90 plus age into 2. ठीक है, शी इज हेयर ओनली, शी इज हेयर डूइंग हाउस वर्क. हाँ जी, सो एग्जैक्ट. डॉक्टर प्रिया से 100 इमेजेस नहीं 1000 करेंगे डियर, बस आ जाओ और खत्म करेंगे कहानी. हाँ जी, व्हाट इज द आंसर कमिंग नाउ फॉर द एक्सपेक्टेड सिस्टोल? हो गया आगे. ठीक है, 90 प्लस एज इंटू 2 फॉर सिस्टोल एंड 55 प्लस एज इंटू 2 फॉर डायस्टोल. दिस इज द एक्सपेक्टेड ब्लड प्रेशर formula on a very busy OPD in if you're working in peds emergency. Then if some baby comes BP not maintaining, roughly इतना पता होना चाहिए. Exactly, Anil has the best answer. Very good Anil, very good, very good. Anil told the right answer, 98/63. So that's acha, very good. So perfect answer. So this is the best answer you can give. Okay, what is this milestone? Can you please tell me? Okay, and you guys, do you guys need a class on milestone? I think you know all the milestones, I assume. If you don't know, then message me, I'll take a class. Hanji, what is this milestone coming to this one? This is nothing but very important, known as tripod position number 1. आ गया 2 मिनट में. Tripod position number 1, or you can say this baby is having sitting with support, or also this baby can have truly sitting with support. Are you understanding? All three have the same meanings: sitting with support, sitting without support. Okay, Vipul, बार Vipul एक सवाल पूछ रहा है, is Kaplan good for INICT? I have no idea bro, I have not taken Kaplan. If I would have taken, I would have definitely told you. ठीक है, हाँ जी, exactly. This is the last question. Sitting with support comes by, exactly, it comes by 6 months. Sitting with support comes by 6 months, and sitting without support comes by 8 months. Okay, remember, okay, if I say when can a baby sit in tripod position, the answer is 6 months. When can a baby sit with support? The answer is 6 months. When can a baby truly sit with support? The answer is 6 months, 6 months, 6 months, 6 months, 6 months. Okay, sitting with support comes by 6 months, and sitting without support comes by 8 months. Okay, last question. हाँ सप्तश्री नहीं, मैंने ब्रेकफास्ट नहीं किया ब्रो, अब मैं आलू पूड़ी खाऊंगा. एंड लास्ट क्वेश्चन, ट्राइपॉड पोजीशन you saw in milestones. Okay, do we have any other condition where you see the patient having in tripod position, tripod heart disease में? Okay, okay. Okay, Navneet says, sir, your face resembles Amir Khan. I think everyone agree. Amir Khan, my face resembles like Amir Khan. We will be better than anyone. हम है, बाकी पानी कम है, remember. ठीक है. Exactly. Tripod position is also seen in acute epiglottitis. In a patient of acute epiglottitis, what sign do you see in acute epiglottitis? Thumb sign देखते हैं ना उसके अंदर, thumb sign in acute epiglottitis and steeple sign in croup. And the treatment for acute epiglottitis is क्या देते हैं? Do we give steroids? Do we give steroids in a case? Which steroid do we give in acute epiglottitis? Which steroid do we give in acute epiglottitis? Yes. So which steroid do we give in acute epiglottitis? Yes, the best answer for this question will be yes, there is no role of steroids in acute epiglottitis. The answer for acute epiglottitis is antibiotics. Okay. Hanji, the treatment for acute epiglottitis is antibiotics, cephalosporin third generation, whereas treatment for the croup will be dexamethasone and adrenaline nebulization. Yes, Swaraj, sir is unique. It's active by own, no comparison. Yes, exactly. We all are unique. We all are amazing. We all, not even me, you all, we are um, super amazing, super. So in the next second half, this that finishes this segment. Okay, thank you so much. In the other half, in the 12 o'clock class, we're gonna talk about telephone receiver femur and some amazing crazy one liners and image based question we're gonna talk about today. Today 6 hours the whole thing will go. Okay, remember that. And yeah, before leaving, we always have a motivating quote, and today's motivating quote is, the only genuine thing you can do to yourself is believe in yourself. The only genuine thing which you can do to yourself is believe in yourself that you can do it. You are born to do it. You were amazing. You are a peaceful soul. You are a beautiful soul, and you will get everything whatever you require to live a happy life. Okay, thank you so much. And the next second half, this was the 1 by 3 session. The 2 by 3 session, the next session basically is after 1.5 hours, exactly at 12 o'clock, with the another set of 500 images. Thank you so much, and please take care. Thank you. Bye, take care. आ जाना टाइम पे, वरना देखो क्या करना है मैंने.